Welcome to the Scenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome to the Deep Dive. Today, we're talking about sleep. You know, that time we all rely on to recharge, reset, basically feel human again.
Right, it's essential.
But imagine if that essential rest was broken up by really frightening experiences, not just bad dreams, but something more intense.
Yeah, something deeply unsettling.
Exactly, where you might seem awake, terrified even, but have zero memory later. Today, we're diving deep into night terrors.
It's a really important topic. Night terrors, or sleep terrors as they're also known, fall under this umbrella term, parasomnias. Basically, unusual things happening while you sleep.
Parasomnias, okay.
And they're quite distinct. We're talking about these intense bursts of fear, maybe confusion, that happen during deep non-REM sleep. That's NREM sleep, usually in the first few hours after nodding off.
So not during the dream stage.
No, that's the crucial bit. Unlike nightmares, which happen in REM sleep and you often remember, with night terrors, the person experiencing it, they almost never recall it the next day. Research, like from the American Academy of Sleep Medicine, shows they're most common in kids, but, and this is key, adults can definitely have them too.
Okay, that distinction right there feels vital. So that's our mission for this deep dive. Really unpack what night terrors are, nail down how they're not nightmares, look into the causes, the triggers, and explore how they look different in kids versus adults. And importantly, what can actually be done about them. We want to clear up the confusion.
Absolutely, demystify it.
Okay, so building on that, let's zero in. What is actually happening during a night terror? People often mix them up with nightmares, like you said. What's the real difference, maybe physiologically?
That's the #1 confusion point, so it's great we're tackling it head on. Nightmares, right? Those are the scary narratives, the bad dreams. They happen during REM sleep, rapid eye movement sleep, which is when our most vivid dreaming occurs.
Right, when you wake up heart pounding because you remember the monster chasing you.
Exactly. You wake up, you remember the scary plot. Night terrors are fundamentally different. They erupt from the deepest stage of non-REM sleep, usually earlier in the night. The person isn't really dreaming in the way we think of it.
So what are they doing then?
Their brain gets sort of stuck. It's partially aroused from that very deep sleep, but not fully awake. This triggers a massive physiological fear response. The screaming, the thrashing, but without the conscious awareness or storyline of a dream.
Wow. So witnessing it must be incredibly frightening. Seeing someone scream, maybe try to get out of bed.
Oh, absolutely terrifying for a parent or partner.
Your first instinct would be to wake them up, right? Shake them, try to snap them out of it.
It totally would be. It feels like the right thing to do. But here's the counterintuitive part. Trying to force them fully awake during a night terror can often make it worse.
Really? Worse how?
It can prolong the confusion, maybe make them more agitated. See, they're in this kind of mixed state. Think of it like being stuck between floors in an elevator.
Okay.
Parts of the brain that control movement might be on, hence the thrashing. But the parts responsible for consciousness, for memory, for recognizing you, they're still deeply asleep. So waking them fully just throws them into more disorientation.
Stuck between floors. That's a powerful image. So if you're witnessing this, what are the telltale signs? What does this mixed state actually look like?
It's usually pretty dramatic. You might hear sudden screaming, crying, shouting. Physiologically, their heart will be racing. They'll be breathing fast, often sweating heavily.
Okay.
Their eyes might be wide open, which is really disconcerting, but they'll look unfocused, maybe blank, or just intensely confused, like they're looking through you.
Not at you.
Exactly. Physically, you might see thrashing, kicking, sitting bolt upright, maybe even trying to scramble out of bed, sometimes quite erratically or dangerously.
And trying to talk to them.
Usually very difficult. They often won't respond, won't recognize you. If you do manage to briefly rouse them, they'll be incredibly disoriented, maybe mumbling incoherently. And then the next morning, nothing. No memory of it whatsoever.
That lack of memory is just wild. It really hammers home how different this is. Okay, understanding the what is one piece, but the big question then becomes, why? Why does this happen? It can't just be random, surely.
Oh, you're right. It's very rarely random. And usually it's not just one single thing. It's more often a combination of factors, certain triggers that can set off an episode. One of the biggest ones is simple sleep deprivation.
Just not getting enough sleep.
Yeah, or having a really irregular sleep schedule. When you're sleep deprived, Your brain tries to compensate, spending more time in that deep NREM sleep stage when it finally gets the chance.
Okay, trying to catch up.
Exactly. But this more intense deep sleep, especially early in the night, can sometimes make the transitions between sleep stages a bit unstable, like creating a fault line where these partial arousals, night terrors, are more likely to pop up.
So pushing yourself too hard, consistently skipping sleep, that could actually be paving the way for these. That's kind of a wake-up call in itself.
It really is. Another major trigger is stress and anxiety. Now, to be clear, night terrors aren't classified as an anxiety disorder in themselves,
Right.
but high levels of stress, general anxiety, they can definitely mess with how smoothly your brain shifts between sleep stages. They act as strong contributors, making episodes more likely.
Okay, so stress is a big factor. What else?
Well, sometimes underlying sleep conditions are playing a role. Things like obstructive sleep apnea.
Where breathing stops and starts.
Precisely. Those breathing interruptions can cause little micro-arousals from deep sleep, potentially triggering a terror. Or restless leg syndrome, that urge to move your legs, can also disrupt that stable NREM sleep.
So it could be something physical happening during sleep, not just mental stress, like you said, a combination.
Often, yes. And then there are other factors, too. Family history plays a part. Things like sleepwalking and night terrors tend to run in families, suggesting there might be a genetic link.
Interesting. So you might inherit more than just eye color.
You might. Also, certain medications, maybe some antidepressants or even stimulants like caffeine or alcohol consumed too close to bedtime, can interfere with the normal sleep architecture and potentially trigger these events.
Okay, so it's a complex picture with multiple potential contributors. Now, you mentioned earlier they're more common in kids, but adults get them too. Let's explore that. How do night terrors look different across age groups? Most people think kid thing.
Yeah, that's the common perception, but the adult experience can be quite different and sometimes more concerning. Let's start with kids.
Okay.
In children, night terrors typically pop up between ages 3 and 12. It's often linked to their developing nervous system, just kind of working things out.
Yeah.
Sometimes a fever can trigger one, or even just a change in routine, like starting school.
So related to development and change.
Exactly. The episodes themselves usually only last a few minutes. And while, yes, they are incredibly alarming for parents to see,
I can only imagine.
they rarely cause any actual harm to the child. Again, the child almost never remembers it in the morning. The really good news for parents is that most kids simply outgrow them as their sleep patterns mature.
That is reassuring, knowing it's likely a phase they'll pass through. But okay, shifting to adults. I'm guessing a fully grown person thrashing around could be riskier.
Definitely. For adults experiencing night terrors, there's a significantly higher risk of injury. They're obviously stronger, more mobile. During an episode, they might fall out of bed, run into things, maybe accidentally hurt themselves, or even a bed partner.
That sounds much more serious.
It can be. And interestingly, in adults, night terrors are often more strongly linked to those lifestyle factors we talked about. Chronic lack of sleep, high stress levels, maybe alcohol or substance use. These can really increase the frequency and intensity for adults.
So less about a developing system, more about external pressures or habits.
Often, yes. And another key difference, adults with night terrors are more likely to have those coexisting conditions we mentioned, like sleep apnea or restless leg syndrome, acting as underlying drivers. It's less common for it to be just an isolated thing in adulthood.
Right, suggesting it might be a symptom pointing towards something else that needs looking at.
Precisely. And the impact isn't just at night. Adults often report significant daytime sleepiness, fatigue, trouble concentrating, because their sleep is being repeatedly shattered.
Yeah.
It affects their work, their mood, their overall quality of life.
That makes sense. Chronic disruption would take its toll.
Absolutely. And in some adult cases, though not all, night terrors might be linked to underlying mental health conditions, like PTSD or even neurological issues. This is why, especially for adults with frequent or severe episodes, getting a proper evaluation is so important.
Yeah.
It could even be something mimicking a night terror, like certain types of seizures, although that's rarer.
Okay, that really highlights the need for professional assessment in adults. So, despite how scary these sound, you're saying there's hope, right? For most people, it's not dangerous, and there are things you can actually do.
Yes, absolutely. That's the crucial takeaway. For the vast majority, especially kids, it's not dangerous and often resolves on its own. And even when intervention is needed, it usually doesn't involve medication right away. The focus is very much on lifestyle adjustments and, when needed, getting professional advice.
So where do you start? What's step one?
Step one is Almost always improving what we call sleep hygiene, basically setting yourself up for the best possible sleep. This means having a really consistent sleep-wake schedule. Go to bed, wake up around the same time every single day. Yes, even weekends.
Oh, the dreaded weekend consistency.
I know, but it really helps regulate your body's internal clock, your circadian rhythm. Also, limiting things that mess with sleep before bed,
Yeah.
caffeine, alcohol, big heavy meals late at night. Creating a wind-down routine is key too. Ditch the screens, phone, tablet, TV at least an hour before bed. The blue light really interferes with melatonin production.
Right. Heard that one before. Makes sense.
And make sure your bedroom is optimized for sleep. Dark, quiet, and cool. Those basic things create the foundation for stable, healthy sleep.
It sounds like creating the ideal environment for sleep to happen smoothly, which tackles that unstable transition idea you mentioned.
Exactly. The next big area is actively working on stress and anxiety. Since we know stress is a major trigger, finding ways to manage it is crucial.
What kind of things help?
Techniques like yoga, deep breathing exercises, mindfulness meditations, even just 5 or 10 minutes can make a difference. Progressive muscle relaxation is another good one.
Okay.
Establishing a relaxing pre-bed routine can signal to your body it's time to wind down. Maybe reading a physical book, listening to some calm music, taking a warm bath, and importantly, trying to address the sources of stress during the day so you're not carrying it all with you into bed.
Taking proactive steps during the day to protect your sleep at night. I like that. Now, you mentioned something earlier for kids' scheduled awakenings. How does that actually work?
Right, scheduled awakenings. This can be really effective, especially if a child's night terrors happen like clockwork, around the same time each night.
Oh, so.
The idea is you gently, briefly wake the child about 15 to 30 minutes before the usual time the terror strikes. Just enough to stir them slightly out of that super deep sleep stage.
Like heading it off at the pass.
Exactly. You interrupt the sleep cycle just enough to prevent the partial arousal from escalating into a full-blown terror. Over time, doing this consistently can actually help regulate their sleep rhythm and break the pattern altogether. It's quite a clever, non-invasive strategy.
That is clever, almost like reprogramming the sleep cycle. Okay, so we've got lifestyle changes, stress management, scheduled awakenings. When does it become necessary to bring in the pros? What are the signs that say, okay, we need a doctor or a sleep specialist?
That's a really important question. Professional evaluation is definitely recommended in several situations. If the episodes are happening frequently, say multiple times a week, and really disrupting sleep quality for the person or the household.
Makes sense.
Also, critically, if anyone gets injured during an episode, as we discussed, that's a bigger risk for adults. Persistent daytime sleepiness or fatigue that interferes with school, work, or daily life is another major red flag.
Right, the knock-on effects.
Definitely. And if there's any suspicion of an underlying condition like sleep apnea, maybe loud snoring, pauses in breathing, or restless leg syndrome, then a sleep specialist is absolutely the way to go for proper diagnosis and treatment.
Okay.
The American Academy of Sleep Medicine is quite clear.
Yeah.
Adults in particular who have frequent or severe night terrors really should consult a sleep specialist. They can do thorough assessments, maybe recommend therapy, treat any underlying disorders, or, in some cases, consider short-term medication if needed.
That seems like clear guidance. So, wrapping this up, it feels like we've established that night terrors are much more than just bad dreams. They're this distinct, pretty severe sleep disturbance coming out of deep NREM sleep.
Marked by that sudden fear, the physical activity, but crucially, no memory.
Right. Most common in kids, often linked to development, but definitely affecting adults too, where things like stress, lack of sleep, or other sleep disorders like apnea often play a bigger role.
Exactly. And I think the reassuring message, zooming out, is that while they are alarming to witness, most cases, especially in children, do resolve naturally.
That's good to hear.
But for those who struggle, focusing on those fundamentals, good sleep hygiene, managing stress can make a huge difference. And knowing when to seek professional help is key. It can really reduce the frequency and impact, leading to better nights for everyone.
Definitely. So you listening have hopefully gained a much clearer picture of these intense, often misunderstood sleep events. It really underscores how complex and frankly fascinating our sleep is.
It really does.
So here's something to think about. Considering how vital, good, uninterrupted sleep is for just about everything we do, what aspect of your own sleep routine, or maybe your family's, might be worth taking a closer look at after our conversation today?
Thanks for tuning in to the Scenario Podcast. Don't forget to visit scenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.